We're going to talk about sleep and Parkinson's disease, which I've talked about before to the Parkinson's support group here in Fresno, but a few updates since we were last talking about this. So I want to give a shout out to my colleagues, Dr. Doris Wong and Dr. Ethan Brown, for taking time to come down and speak to us today. And I really appreciate them making the drive down. So, just to talk a little bit about Parkinson's, I think most people sort of see Parkinson's as something that really affects your movement, and many people experience tremor, slowness of movement or bradykinesia, rigidity or stiffness, as well as problems with balance and walking. But I think many people recognize now that it's really more than just a motor disorder or a problem with movement, and there are a number of non-motor issues in Parkinson's that affect people, like sleep. Many people experience frequent urination, constipation. Some people experience depression and anxiety, as well as sleep problems. And I wanted to take a poll of the group. How many people have trouble sleeping at night? Okay, so about maybe a third of the folks. Just some more hands going up in the back, I see. I have problems sleeping at night too, so I can certainly relate and think it's really important. So about 80% of people with Parkinson's experience some form of difficulty with sleeping. And there tends to be an overall reduction in the amount of sleep that you get every night, as well as trouble falling asleep or sleep latency. And then people also have problems getting enough deep sleep, which we call stage N3 sleep. And it really tends to be a big problem. And there are a number of issues with Parkinson's that lead to this difficulty in getting enough sleep and deep sleep. Number one, it can be caused by various sleep disorders that are related to Parkinson's, as well as by the motor symptoms of Parkinson's, like tremor or stiffness when you're in bed. And then many of the non-motor symptoms of Parkinson's can also contribute to staying asleep or falling asleep at night. So we're going to talk about those things in a minute. I also just wanted to say that there's been a lot of research done about sleep and Parkinson's, and people really want to know, when you get a good night of sleep with Parkinson's, what are the benefits? And it can certainly help improve the motor symptoms of Parkinson's, like tremor. Some people have extra movements from the medications that they take called dyskinesia. It can really help with your daytime energy and feeling like you've got enough to get through the day, as well as your cognition or ability to think. Am I getting a lot of feedback on the mic? Yeah, okay. Maybe I'll step back and talk over here instead of into the mic. Can you guys still hear me? Okay, good. So we're going to go through this talk today and talk about the sleep disorders that result from Parkinson's disease, as well as the common Parkinson's symptoms that impact sleep, and then also one common sleep disorder that can impact Parkinson's disease and sleep. So starting with sleep disorders that can result from Parkinson's itself, anybody ever have nights like this, where you're lying in bed and just really can't fall asleep? Okay. I have a feeling some people aren't raising their hands, but that's okay. This poor guy really can't fall asleep. He's having a lot of problems. It seems like his mind is really active and he's got a lot of bags under his eyes. And so I would characterize that as insomnia, problems falling asleep at night. And it's very common in Parkinson's disease. About 50 to 60% of people with Parkinson's tend to complain of having trouble falling asleep. And many of the patients are on medication to try to treat this. I should also say that insomnia can result from things like depression and anxiety, which are common in Parkinson's. And insomnia can worsen those. So it becomes a vicious cycle, and it's really important to identify those issues and treat them. And so the impact of insomnia on Parkinson's disease, of course, is that it can cause a late night, like that gentleman in the picture, and it can really disrupt a night of consolidated sleep. Many people the next day, after having poor sleep or short sleep times, can feel that their motor symptoms are worse. So the tremor's worse, they feel more stiff, not moving as fast as they would otherwise. And their ability to think also tends to worsen. So cognition can be impacted. Some people have trouble with their short-term memory, as well as their ability to kind of see things around them and plan out how they're going to walk or move in their house or outside of the house. And so the treatment of insomnia really kind of depends on what the cause is, but I think many sleep disorder specialists will say that your sleep hygiene is really important. And this includes things like turning off your iPhone, which I think many of us are guilty of keeping our iPhones either on our nightstand or very close to us. Turning off laptops or TVs, anything that has a really bright screen, you want to turn those off about an hour before bed to reduce the stimulating effect of that blue light on your system. One of the other things that we talked about with sleep hygiene is making your bedroom strictly for sleep and sex. Those are the only two things that really should be happening in your bedroom. So you shouldn't be doing things like eating in bed, watching Netflix in bed, things like that, which can really stimulate you. And then we also talk about avoiding work, eating, or exercising close to bedtime, because all of those things can be really stimulating to your body and its metabolism and keep you awake for longer than you might really want to be. There's been some interesting research on what are called blue light glasses, blue light therapy glasses, which can be worn in the late afternoon. And what these glasses do is they help to filter out the blue light from screens like TV, your laptop, an iPhone, and reduce the impact of that blue light, stimulating your wakefulness system, and can really help some people feel like they get better sleep and fall asleep easier at nighttime. And then finally, just like we were doing a few minutes ago, exercise and yoga has been shown to be beneficial in helping people fall asleep much faster at night. So again, you want to avoid doing that in the evening or at nighttime while you're winding down to go to bed, but if you can get involved in some rock steady boxing, doing some yoga, tai chi during the day, all of that can really help with you falling asleep easier at nighttime. If you've done all those things and you're still having trouble falling asleep, there's actually a recommended therapy called cognitive behavioral therapy, which is a really directed course over 4 to 6 weeks that can help reprogram your brain to fall asleep at nighttime. And it's really the most beneficial approach for insomnia, either in Parkinson's or simply because you have insomnia. And there are a number of ways that you can interface with cognitive behavioral therapy. There's an application on your iPhone that was developed through the VA at Stanford called CBTI Coach, which you can download on your iPhone. And this application basically helps you to identify a number of factors, in your day-to-day life that may contribute to trouble falling asleep and help you to identify those and then reverse them. As well as other mindfulness techniques such as deep breathing, progressive muscle relaxation, which all have been shown to help falling asleep at night. There actually is a neuropsychologist in Fresno who performs this cognitive behavioral therapy. Her name is Dr. Katerina Mosty at University Sleep and Pulmonary Associates. And she's actually able to do one-on-one coaching with people through this whole process of learning how to reprogram your brain to help you fall asleep at night. So that's really a nice resource to have. And there are a number of online resources as well that do cost some money, but can walk you through this process of cognitive behavioral therapy. And the two websites are Sleepio and myshuteye.com. Okay, so part of getting treatment for insomnia is, number one, recognizing that you have this problem. So, of course, talking about that with your physician is key. And a referral to a sleep medicine specialist may be helpful as well. Just to determine are there other sleep issues that might be popping up, contributing to trouble falling asleep at night. And certainly if you have any depression or anxiety, it would certainly be worthwhile to discuss that and get treatment for that as well. As I mentioned earlier, it's a vicious cycle when insomnia impacts anxiety and depression, and that impacts your ability to fall asleep. We always get questions about medication for insomnia, and I think for many people it seems like a good quick fix to take something to help you fall asleep at night. In general, I try to avoid medications for insomnia, just because of the long-term risks that this may have on the person's ability to think and their cognition. But certainly I would recommend people to speak to a sleep specialist about that. All right, so restless legs is the next sleep disorder that I wanted to talk about, which is quite common in Parkinson's. And this picture, it might be better to have a video next time, but this picture is intended to depict somebody who's been kicking their legs quite frequently throughout the night. And you can see that the sheets are really kind of rumpled up and thrown all about the bed. And so restless legs is one of those disorders that can be sometimes hard to describe, but many people have said that it feels like creepy crawlies in the legs, feels like a numbness, a tingling, discomfort, my legs are asleep. So there are many ways to describe the sort of sensation that happens in the legs. And there are a number of other criteria that help us to identify this. One is that it's usually occurring at nighttime, or it gets worse during the evening or night. It gets worse with inactivity or rest. If you're sitting down in a chair or lying down in bed, it tends to bring out the symptoms. And then finally, these symptoms tend to improve with activity. So many people will describe that they get up out of bed or out of their chair and walk around, and it seems to really calm down the symptoms that they're experiencing. And this is quite common in Parkinson's. About 20 to 34% of patients have this. Anybody in the audience have restless legs? Or Okay, so a number of people do, and it can be quite bothersome. You know, restless legs can cause significant discomfort as you're trying to fall asleep and can, you know, lead to a problem falling asleep. But some people have even described that they wake up in the middle of the night with this symptom and can be very bothersome. And a number of studies have looked at what is the impact of restless legs on your ability to think and your cognition. And those who, you know, who have restless legs tend to have, you know, problems with their cognitive abilities and sleep quality compared to those without restless legs and Parkinson's disease. And so the treatment of restless legs really starts with checking an iron level and supplementing that. But really, that tends to be insufficient in Parkinson's, at least in my own personal experience, as well as with the research that's been done. And so there are a number of medications that can be tried. And I think, you know, over the course of the past maybe 10 to 15 years, there have been certain medications that have been advertised on TV. You may have seen them for restless legs, such as dopamine agonists like Mirapex or Requip. I personally tend to prefer using things like Gabapentin, which is a medication that's very commonly used in neurology and can be very effective for restless legs. But a number of cousins of that medication can be very helpful as well. There's one called Horizon, which is a long-acting form of Gabapentin, and is FDA approved for the treatment of restless legs and has been shown to be beneficial without really significant side effects. Lyrica is another medication that's used commonly for pain, but has been shown to be very effective for restless legs. And then finally, medications that are typical for Parkinson's disease, like carbidopa, levodopa, can be used. But I generally reserve those for kind of more of a second-line approach to this. And so speaking with your physician about the right medication for you is important. Now, am I able to exit this and show this clip, or can I just click on the link?
Well, yeah, let's see what happens.
Let's see here. No, it doesn't look like it.
Experimental presenting. Do you want me to open up the YouTube for you?
That's okay.
If we have time, I will.
Yeah, at the end, maybe we can show the video. The videos are quite dramatic, which is why I like to show them, and it does a better job of depicting this than what I can usually describe. But there's another sleep disorder that is commonly seen in Parkinson's disease called REM Sleep Behavior Disorder. And this is a disorder where people tend to act out their dreams to varying degrees. Anybody in the audience either have a person that they love or experience this themselves? Okay, we got some people holding hands up over here in the front. So there's quite a number of people who experience this at night. And this is really, you know, anything from just talking or mumbling during sleep to actually moving around during sleep. And I've had patients who have described even really complex behaviors like getting out of bed and acting out their dreams to a certain degree. So it can be very frightening, and the behaviors are often very aggressive or violent. It can be frightening to caretakers who are often observing these behaviors that happen at nighttime. I see you smiling because you held this hand up earlier. This is quite common in Parkinson's disease, and I think as we recognize this more as a sleep disorder that results from Parkinson's, you know, we found that it's much more common, up to about 50% of people with Parkinson's who experience this. There's another video maybe we can show after. But the impact of REM behavior disorder in Parkinson's really is more related to safety of both the patient and the caretaker. And you could imagine that if the patient is moving around during bed and maybe falls out of bed, there's a sharp piece of furniture, like a nightstand next to them, and they hit their head. That could be quite injurious and bothersome. And so, you know, these behaviors may also put the caretaker or the bed partner in harm's way, you know, with kicking or punching that can happen with this disorder. And certainly, you know, if you're moving around frequently during sleep, you know, you can have problems with cognition as well, which can impair your attention, your ability to speak clearly and find the words that you want to say, what you want to say, as well as your short-term memory. And so, the treatment of this really, I think, starts in the bedroom and making the bedroom a safe environment for folks who have this particular disorder, which includes removal of furniture from near the bed. Some folks have put pads, you know, right next to the bed in case people fall out of bed, as well as putting up rails to make sure that the patient doesn't fall out of bed. Removal of sharp knives and guns, of course, for folks who have this, you know, removing that from the room and putting that in the safe. Because there are some folks who have, you know, access to that, and you know, I've heard stories, not necessarily in my own practice, but from other providers where people have used, you know, these weapons in defending themselves from whatever aggressive threat that they see, you know, in the dream. And then finally, there are two medications that have been fairly thoroughly studied for this, and I generally recommend melatonin that you can get over the counter to treat this because it's fairly easy to get, it's fairly well tolerated, there really are little side effects in interaction with other medications you might take. And then clonazepam is the other medication for those cases where REM behavior disorder is quite severe. Okay, so we're going to talk about some common Parkinson's symptoms that can impact sleep, and the first one is nocturia, which means getting up at night to urinate. So that's what this picture is depicting here. Anybody have problems with getting up at night and having to urinate frequently? Okay, so a lot of folks are raising their hands, probably more than REM behavior disorder. And so, Parkinson's disease can impact the control of your bladder. Certainly it could be related to other issues which are common in older men, such as an enlarged prostate. But I've had patients who have said, hey doc, I'm getting up 7, 8 times a night to urinate. And other people just say, I get up once a night. But regardless of whether it's once a night or 8 times a night, it's an important symptom to identify because it does disrupt your sleep and can wake you up frequently in the middle of the night. And so the treatment of nocturia really, I think, for neurologists needs to go hand in hand with a urologist who has specialized knowledge of these medications. But as movement disorder specialists, we have a number of medications that we're familiar with and use to treat this. And the reason why we pick these medications is to try to reduce the amount of side effects that they may have. And so the medications that we commonly recommend are Nocturia, Myrbetriq, or Vesicare, which have been studied in Parkinson's and shown to reduce the amount of time that people get up at night to urinate. But certainly other medications can be used, and evaluating the side effects from those medications is important. And finally, Botox is an alternative as well, which may be sort of a last resort, but would be performed by a urologist. And sometimes, the treatment of symptoms from whatever disorder we're treating, can be kind of more practical rather than medication-based. And so I've had patients who have said, forget taking a medication, forget the side effects. Let me just put on a catheter, use a catheter at night, so I can just sleep through the night and urinate without being disrupted. And so in that particular case, really kind of depends more on your perspective and what your goals are for treatment. And some people have said, I'm just going to wear a diaper, and in the morning I'll change it, so I don't have to get up out of bed and go urinate. So again, it really depends on your approach and personal preference regarding medications. So another disturbing symptom that can impact sleep are hallucinations, which can happen at nighttime in patients with Parkinson's disease. And I remember the first time I spoke with this group, there was a gentleman who described a very scary hallucination that he had when he looked to the side of his bed at night and saw a deep canyon. So he was afraid to get out of bed because he thought he was going to fall into the canyon, which is quite scary. And then he told me he turned over to the other side and saw a woman in bed with him who was not his wife, and he thought that was quite exciting compared to the canyon that he had. And so hallucinations, they can be very, very complex, like the canyon or the person in bed next to him, or they can simply be geometric shapes or shadows. But they commonly occur in Parkinson's disease, so you could imagine how that would impact your ability to fall asleep if you're seeing these things at night. And they can be due to Parkinson's itself, progression of the disease. They can be due to medication. They can be due to infections. And as I mentioned earlier, it can be worse at night as the lights go down, but can occur throughout the day as well. Anybody here have hallucinations or experienced hallucinations before? Okay, so a couple folks in the front here, maybe not as many as other symptoms. These can be really disturbing or frightening, like I mentioned with the gentleman who saw the canyon next to him, and can certainly prevent sleep if you're scared of what you're seeing. And this can also cause problems for caretakers, who may try to calm down a patient who's having a very scary hallucination. So can really be disruptive. And so the treatment of hallucinations really depends on the cause. And it can be anything from reduction of medications that are commonly prescribed for Parkinson's, which can increase the risk of hallucinations. Treatment of infections is also very helpful. If you have a urinary tract infection or pneumonia, the treatment of that is important. And then once you've kind of taken all those routes, you've identified all the issues which may contribute to hallucinations, then treatment with a medication may be indicated with either Seroquel or Nuplazid. And speaking with your physician about what choice of medication is very important. So another issue that can impact folks with Parkinson's during the middle of the night is what's called wearing off. Anybody here experience wearing off? Okay, I see Bud raised his hand, a couple other folks. So wearing off is kind of a fancy term to describe when your symptoms of Parkinson's reemerge after you've taken your medication and the effect is worn off. And it can be anything from tremor to stiffness to slowness of movement, or what's called dystonia or abnormal muscle cramping. And usually this is because of too little medication, where again the symptoms of Parkinson's reemerge after you've taken your dose and it's worn off. And so the impact of wearing off in Parkinson's has been studied, and it can certainly cause significant discomfort at night, but can also cause a lot of awakenings. If your tremor is kicking in, if you're having an abnormal muscle cramp, that can be discomforting and wake people up in the middle of the night. So it's important to identify that in treatment. And again, folks have looked at what are the different treatment options for wearing off. Adjustment or change in medications can certainly be helpful. Studies have shown that long-acting medications typically tend to be more helpful at nighttime rather than short-acting medications, which are more commonly prescribed. And Cinemed extended release or Azilect are a couple of those options. If somebody's having dystonia or very painful muscle contractions or spasms, then Botox can be a very helpful option. And deep brain stimulation can also help folks who are wearing off. And I would caution and say that this is not specifically used for wearing off at nighttime, but if this is happening all throughout the day, then it's certainly worth a discussion with your neurologist to talk about whether deep brain stimulation is appropriate for you or not. So finally, there's one common sleep disorder that can impact Parkinson's disease, which I think is probably more common than most of the symptoms that we've talked about today, and that's sleep apnea. People familiar with sleep apnea and what that means? Okay, so a fair amount of folks in the crowd. Sleep apnea, well, I tried to pick a picture that would depict that. Again, it might be more helpful to have a sound recording, but this gentleman here is snoring at night. You can see his wife has somewhat of an incredulous look on her face, like, can you please just shut up? Hopefully people aren't saying that to each other in this room. But sleep apnea is a problem with breathing during sleep, where you either have complete stoppage of your breathing, or you have some trouble with breathing that usually is represented by snoring at night. And that can cause multiple awakenings because of this problem with breathing. It can lead to daytime sleepiness, where you're taking naps all the time, and impact your cognition as well, to where you just feel like you have a brain fog and you can't think very clearly. And so the impact of sleep apnea and Parkinson's really, I think the main symptom that people experience are daytime sleepiness, where they feel fatigue and they want to take a nap frequently. But it has an impact on other medical issues that you might be dealing with, like high blood pressure, diabetes, strokes, heart issues, and as I mentioned, can worsen cognition. So identification of sleep apnea is really important, as well as the treatment of it, to try to curtail these issues. And so the diagnosis of sleep apnea really depends on the sleep study, which can either be performed at home or at a sleep clinic. And then the treatment of that typically revolves around the use of the CPAP machine, which is a machine that essentially helps you to breathe at night and stabilize your airway. There certainly are other treatments available, but CPAP is generally considered the main treatment for this particular disorder. And again, a discussion with your sleep disorder specialist is important. Now, can I pull up those videos just to show what REM behavior looks like? I think it's always fun to see some videos rather than just hear me talking about it.
While I do that, are there any quick questions at this point?
Sure.
Yeah. Last time you were here, you said there wasn't anything finalized yet, but a lot of people are having good success with the CBDs. Had any experience yet with that? Or?
Yeah, so there aren't currently any medical studies in Parkinson's with regards to CBD, and the medical community sometimes is a little bit slow to warm up to alternative therapies, I should say. So generally, when I recommend to patients is, if you're going to try CBD, do it cautiously and then get back to me and let me know. And I've had a number of patients who, they take it for different reasons, for anxiety, for tremor, for sleep. I've had some patients who, I think in general, feel like it does help. Some patients have had a bad reaction to it, or maybe they just get a little bit paranoid at nighttime. And so, again, with any sort of treatment option where we don't have great research and understanding of how it impacts people, I just say take it with caution, use the lowest dose possible, and see if it works for you. So So it's not, I don't strongly recommend it. Great, thank you. So this is a video of the original case report of REM behavior disorder that was described at the Stanford Sleep Lab. And this is a gentleman who has a form of Parkinson's, not Parkinson's disease itself. And while he was being monitored overnight, they found that he had a number of complex movements, which we'll see here in the video. So you might be able to appreciate some flickering of the hand. And then he gets up and has these quite complex and violent behaviors. So you can imagine if there was somebody in bed next to him, that they would be the brunt of that particular set of movements, which is really quite bothersome because the patient isn't aware that they're performing these behaviors. So I always recommend that treatment is quite important. I'll just show you one more and then we can take some more questions. This next video is a patient who filmed himself, has a diagnosis of REM behavior disorder, but this is again to depict how violent these behaviors can be. So he hits his head on the furniture next to him and then falls out of bed and quietly gets back into bed. So again, I'm not intending this to necessarily be funny, but to depict sort of the complexity and violent behaviors that can be seen in REM behavior disorder. Okay, any other questions? Yes, in the back.
Sorry.
I've been to a neurologist and been put on Flomax a number of years ago. And I just read a study that says it's a different drug for prostate enlargement. It helps, in some cases, Terazosin or Terazosin.
Sure.
Can you speak to that at all?
Yeah, so that's a medication that a urologist probably is more familiar with. That's a specialist who focuses on these types of issues. So the question was about, that you were put on Flomax for treatment of urinary issues. And it's not one that I commonly prescribe. I'm not as familiar with that. But certainly I've seen a number of patients who have been put on that with some good results. And I generally ask the urologist to help me out in those cases. But that can be an effective medication for urinary issues. Say that again.
There was a study that was done in the University of Iowa looking at it actually slowing down or halting the symptoms of Parkinson's.
Oh, really? That study...
A different drug works differently in the brain.
Yeah, I'm not familiar with that particular study. That's interesting. There have been a lot of different studies that have looked at, what can either slow down or stop the progression of Parkinson's disease. And I would have to say that, most of the studies really have been quite equivocal. I think Dr. Brown mentioned a few of them earlier in his talk. I really think that the one recommendation that we do have for slowing down Parkinson's would be exercise and cardiovascular activity. So things like rock steady boxing, stationary bikes, at a local gym or in your house really are important. But with regards to that specific study, I'm not aware of that and not one that we commonly talk about. Yes?
Can you please just repeat your recommendation for the melatonin and the amount of the milligrams for radio?
Sure, absolutely. So melatonin can be obtained over the counter, and generally the dosage that I start with for REM behavior disorder is anywhere from 3 to 5 milligrams at nighttime, and can be increased up to a maximum of 15. But I really would, give a dosage a fair shot for at least a week before making any adjustments, and of course talk to your physician about making adjustments. There's another question over here, it looks like.
Yes, I have a question about, has there been any improvements or for stem cell research and how is that progressing?
Yeah, stem cell research, I believe that there are some institutions that are looking at stem cell research. And I'm not really sure that there's anything that's been done in humans at this point to, at least in the United States, to see if that's beneficial with Parkinson's. I don't know, Dr. Brown, are you aware of any? Yeah, usually outside of the United States, I think they're a little bit farther ahead with stem cells. But at least in the United States, we don't have any human studies, I'm pretty sure. Yeah.
Yes, stem cell, there's a big history with stem cells in Parkinson's disease. As people may know, these were looked at a long time ago. It didn't really work, and actually the stem cells seem to get some of the Parkinson's disease spread into the stem cells. So there are a lot of people that think that stem cells may not be the right answer for Parkinson's, but there are some ongoing studies, I believe in Australia, and maybe there's one here in Southern California, in New York. So there's still some people that are interested in it. I think in the research community, people are wondering if it may not be the right type of therapy for Parkinson's, but then there's some that are still very interested. So we'll be on the lookout for it.
Yeah. Thank you. Yes, sir.
I have muscle pain real bad, my arms and legs, the restless legs. They have me on Gabapentin, but it does not help at all.
On Gabapentin?
Yeah, I take
Yeah.
that. I have muscle spasms real bad at night. Is there anything else I can take? I mean, I'm up almost all night long. I can't sleep it up.
Yeah. I certainly think that Gabapentin is a good first medication to try. There certainly are. The question was, I have a lot of muscle cramps and pain at night in my arms and shoulders and restless legs, and Gabapentin is being used but not very effective. And I think it's a great first medication to try. There are many people who get benefit with that. But in those cases where there's still a significant amount of discomfort, and generally I try to switch to a different, more powerful medication, like Lyrica, for example, is one of them. Lyrica. Yeah, Lyrica. It's a brand name for pregabalin. And it tends to be more potent. And so certainly I would talk to your physician about that and see if you can switch. Now, muscle cramping can come from a lot of different things. And if you have Parkinson's, it could be, dystonia, or it could be stiffness from the Parkinson's. So taking a look at your medications for treatment of Parkinson's could also help. Yeah. Sure. Yes.
My husband, he has Parkinson's, and he has sleep problems, and it's really, really bad, so we can't sleep in the same bedroom because I get beat up. And he also has sleep apnea, but he can't tolerate the mask because he thinks it's a snake that's attacking him, so the mask goes on. We tried his bed rails, and he's got caught in it, and now I have padding over the bed rails. He screams and yells and calls for help, and all during the night. He's on classic, and I tried melatonin, but that seemed to aggravate it. So it's like, what else can I do? Because then he doesn't sleep all night, so then he wants to sleep all day.
Sure.
Or he'll just fall asleep. He'll be eating. Pretty soon he's asleep with a piece of apple in his hand. And I know it's from not getting any sleep during the night.
Yeah. So the question was that her husband has Parkinson's disease and sleep problems related to REM Behavior Disorder. It sounds like as well as hallucinations and sleep apnea. So many of the issues that we talked about today are very complex. And there's some hallucination that the CPAP mask, which usually is connected to the machine, looks like a snake. And in addition, once he falls asleep, there's a lot of movement and yelling and screaming, and bed rails have been put up, but there's still a lot of those sort of violent and complex movements. And Nuplazid, which is a medication typically used for psychosis in Parkinson's or hallucinations, hasn't done the trick. And that's a really complicated situation. And what I would recommend is probably trying a different type of medication for the hallucinations. There are other alternatives. One of the concerns that we have is that these medications can worsen the Parkinson's symptoms, like stiffness and tremor, slowness of movement, but at the end of the day, quality of life is really important. And so it's a balance that we have to strike with these medications. So I certainly would suggest, at least exploring a different type of medication for the hallucination. And again, speaking with a sleep specialist about, an option other than melatonin. I mentioned clonazepam, in the talk. There are other medications that are really less well studied, but could be tried, that we also use in Parkinson's. But that's a really complex situation, especially if you can't use a CPAP, which could worsen, the nocturnal behaviors at night.
Right, and we tried the kind that they have where it's just a mouthpiece
Sure.
instead of the mask, but because he fought something in his mouth that broke off his front teeth. So,
Yeah, that's just.
tried it made it worse.
Yeah, that's really tough. Yeah, so the story was about using a mouthpiece for sleep apnea, but because these behaviors are so violent that it broke the front teeth. So I really would just take another look at your medications and really see if there's a combination that could be changed, because the new plasma sounds like it's not working, and the REM Behavior Disorder is quite out of control. So, I've heard of a couple people who, in my own practice, who have had sort of what we call a paradoxical reaction to melatonin. So melatonin typically calms down the behaviors if they're related to REM sleep behavior. But I've had a couple of folks who have said, you know what, I really got worse on it, so we switched to clonazepam instead. So that might be worthwhile to try.
Is that over the counter?
No, it's got to be a prescription, yeah. Yeah, it's got to be a prescription, yes. You had your hand up for a while.
So we actually have this gentleman in purple. If we could go in order, that would probably be great.
I thought I heard you say that for RLS, I thought I heard you say that for RLS you prefer Gabapentin over Mirapex. Would you please explain why?
Yeah, so, gabapentin is a medication, as I mentioned in the talk, that's used for a number of different reasons in neurology, for nerve pain. Psychiatrists may use it for anxiety. It's been shown to be helpful in restless legs. Mirapex can be very helpful for restless legs. I don't want to downplay that, but there are a number of side effects which are quite disturbing for me, as a practitioner. And so Mirapex is in the class of medications called dopamine agonists. There's Mirapex, Requip, Nupro patch is another, which are commonly used in Parkinson's and restless legs. There are certain people who, over time, on these medications can develop worsening of their restless legs and experience them earlier in the day and in other parts of their body other than their legs. And, if that situation starts to occur, we call that augmentation, then, I, as a sleep practitioner, try to get people off that medication, rather quickly with the help of, something like Gabapentin or Lyrica. The other sort of disturbing side effects that can result from these medications are what we call impulse control disorders. And patients who are on these medications may develop things like impulsive eating, impulsive gambling, impulsive online shopping, sexual behaviors, etc. And so, and somebody I'm treating with these, I ask those questions quite a bit because I want to identify them before they really cause problems. I had one patient who came in to me and said, I've been on Requip for my restless legs for many years, and I've increased the dose because the symptoms keep getting worse. And on further questioning, she said she had spent hundreds of thousands of dollars, and she was on the brink of divorce because of that. And other physicians had sort of written her off and said, no, that's not related to your medication. And when we used Gabapentin and got her off the Requip, she stopped spending that money and saved her marriage. So these are really important things to ask and sort of be in tune with. And that's why I don't recommend those. Sure. Great question. Yes.
Hi, my question is about the VA hospital compared to non-VA. I don't know how to work with them to get them to do more for my father based on all the treatment that we have out there and the new treatment and the studies and the second opinions, and they're basically not treating him with any medication at this time, stating that he's too far along, and I don't know what that means. Is that a thing, that patients are too into the stages that they don't need medication or can't use symptoms can be monitored and, you know what I mean, calmed down, and they can be, you know, at least comforted with medication at any time point, you know, during the stages of it.
Yeah.
So what can I do to get that looked at, or who can I talk to, or what medication can be offered to the VA that I can, you know, talk to them about?
Yeah, so there's multiple questions wrapped up in that, and the first answer to your question is that, you know, the San Francisco VA has a Parkinson's clinic that's one of 6 nationally, and so, you know, we do a lot of telehealth to, you know, surrounding VAs across California and even out of state. So, you know, if you're wondering about a specialized opinion, you could ask your primary care neurologist for a referral to the San Francisco Parkinson's Clinic, and we can do a video visit with you to talk about that. You know, the VA does have access to a lot of the new medications that have come out. Sometimes it, you know, it sort of fluctuates, and we may not get access to a brand new medication just because of the cost. But at least through the San Francisco Parkinson's Clinic, you know, we have, you know, Dr. Doris Wong works there and performs DBS, you know, for Parkinson's and other disorders that we treat. You know, we have specialists who, you know, are involved in clinical trials, and we also have, I would say, fairly up-to-date medications, actually. There's another question that you had about, you know, advanced disease and whether medications would be helpful in that particular case. And, you know, I think as a physician, we really want to try to balance the side effects with the benefit. And it's important to explain our thought process and say, hey, you know, if we start you on carbidopa-levodopa at this point in the game, depending on where you are, you know, with cognitive issues or hallucinations like we talked about, you know, we want to make sure that we're doing the right thing and not creating problems, you know, for the patient and the caretaker. So it really depends on the situation, and I certainly wouldn't say that we don't treat advanced Parkinson's, because we do. Yeah.
Okay, we have one final question, and then we're going to hear from our advocate, Sharon Christian.
Doctor, can you speak on what the current research has to say in regard to the use of oral appliances versus the CPAP machine in facilitating airflow?
Yeah, so the question was about sleep apnea and whether using a CPAP machine versus an oral appliance, you know, what the research has shown. And similar to Parkinson's, I think treatment has to be individualized to the patient. So for somebody, for example, who has severe sleep apnea, where they're pausing their breathing frequently during the nighttime, their oxygen levels are dropping because of that difficulty with breathing, then really I think CPAP is the main option to go, because it's almost like a splint for your breathing tube and allows the airflow to pass through and really stabilizes the breathing. You know, oral appliances have been shown to be effective for treatment of sleep apnea. For those who aren't aware of what oral appliances are, they're a bulb that's created by a dentist that pulls your lower jaw forward and removes the pressure on the breathing tube, or at least the opening of the breathing tube, to help stabilize breathing at night. And in that particular research, really mild to moderate sleep apnea benefits from an oral appliance. But severe sleep apnea, generally don't recommend that. There are a number of other issues to consider too, where with an oral appliance, people may get TMJ issues, so jaw problems. And if you're, you know, if you're having locked jaw as well, where you open your mouth and your jaw just tends to stay open, that usually is a contraindication. So, you know, in the particular case of your husband where he broke his teeth, I mean, that situation where he's moving around frequently during the night, I think would make an oral appliance really not a great therapy for him. And so you have to individualize the care.
Thank you, Dr.
Okay, great.